Hi, my name is Jessica. I'm going to be doing a neurological examination on you today.
Okay.
So I've identified the patient with his name and his date of birth. I've washed my hands. So I'm just going to grab some gloves. And then we're going to start with assessing your mental status. So I'm going to ask for you, can you tell me your name?
Arthur Todd.
Can you tell me your date of birth?
May 14th, 1992.
Can you tell me where you are right now?
My bedroom in California.
And can you tell me the year?
2020.
Okay, so he's alert and oriented times person, place, and time. Next, I'm going to assess your thinking. So can you tell me how are a trumpet and a flute similar?
They are both musical instruments.
Okay, so his thinking is abstract. Next, I'm going to assess your attention. So I'm going to ask if you can count backwards by 10, starting from 100.
100, 90, 80, 70, 60, 50, 40, 30, 20, 10, 0.
Okay, very good. Next, I'm going to test your comprehension. So I'm going to give you these flashcards with one-step and two-step instructions.
Okay.
And then I want you to start with the one-step, and I want you to read the instructions out loud and do what it says. Okay?
Tilt your head to the left.
Very good. And then this is the two-step instructions.
Close your eyes and stick your tongue out.
Okay, so he's able to follow commands. Thank you. Next, I'm going to just test your general knowledge. So can you tell me who the current president is?
Donald J. Trump.
Okay, and then can you name 3 states?
California, Texas, and Nebraska.
Okay. Now I'm going to test your judgment. So can you tell me what would you do if you found a wallet on the sidewalk?
I'd pick it up and try to find its owner.
Okay, so his judgment's intact. Next I'm going to assess your memory. So I'm going to tell you 4 words. And then I want you to repeat those words. And then I'm going to ask you a question. And then, like an off-topic question. Mm-hmm. And then I want you to say the 4 words from before.
Okay.
Okay? So, dog, car, flower, and soda.
Dog, car, flower, and soda.
Okay, so what did you do for your birthday last year?
I had a barbecue and a pool party.
Okay. Now, can you repeat those 4 words from before?
Dog, car, flower, and soda.
Okay, so his memory is intact. And throughout the examination, I also assessed his vocabulary and his articulation, and there was no abnormal findings. So next I'm going to assess your cranial nerves. So I'm going to start with cranial nerve number 2. So that's to assess your optic nerve. So we're going to use a handheld Snellen chart. Okay. And I'm going to stand 6 feet away from you. And I want you to tell me, cover your right eye. And then I want you to read the smallest line that you can read. Okay?
L, T, F, P, H.
Okay. Uncover your right eye, and then with your left eye, cover your left eye. And I want you to read the smallest line.
L, T, F, P, H.
Okay. And with both eyes open, I want you to tell me, read me the smallest line that you can read.
L, T, F, P, H.
Okay, so his right eye is 20/20, left eye is 20/20, and vision with both eyes is 20/20. So next, I would use an ophthalmoscope to assess the fundus of his eye. So what I would do is I would turn it on, I turn the diopter at 0, and then I would hold it, I'd use my right eye and my right hand to assess his right eye, and then my left hand and my left eye to assess his left eye. And I would tilt the handle at about 20 degrees, and then I would keep it 15 inches away from his face, and I'd have him look up over my shoulder and against the wall. And then I would flash the light in his pupil, and I would look for the red reflex, which is indicating the retina. And then I want to adjust and focus by using the diopter, and then I want to use my opposite hand to hold his head, and then put my thumb at the forehead to help stabilize the head. And then I'll look for the optic disc. And the optic disc should be round, and it's like yellow and orange in color, and I'd assess its size and the margins, they should be sharp. And then I would look at the retina and I'd distinguish the arteries from the veins. Next, I'm going to test your pupils. So I'm just going to flash a light in your eye. Okay? Okay. So the pupils are equally round and reactive to light. They are 2 millimeters. And next I'm going to assess cranial nerve number 3, 4, and 6, which involves eye movement. So I want you to follow my finger with just your eyes, okay?
Okay.
So we did up and right, up and center, up and left, and then in between the nose to test for convergence. Down and right, down and center, and then down and left. Okay, very good. Next, I'm going to test cranial nerve number 5, and that is facial sensation. So I'm going to rub 3 things. I'm going to start with one object, and I'm going to rub it on your forehead, and then your right cheek, your left cheek, and your chin. And I want you to tell me if it's dull, soft, or sharp. Okay, and I need you to close your eyes for this part. And remove your mask for me. Okay. So we're going to start with your forehead.
Okay. Dull.
Okay. Your right cheek,
Dull.
left cheek,
Dull.
and your chin.
Dull.
Okay, very good. I'm going to test a different object now. And I want you to keep your eyes closed, and we're going to do the same thing.
Okay.
Okay? Is this dull, soft, or sharp?
Soft.
Okay.
Soft. Soft. And soft.
Okay, very good. And then we're going to test one last object, and I want you to tell me if it's dull, soft, or sharp.
Sharp. Sharp. Sharp. And sharp.
Okay, very good. You can open your eyes now. And keep your mask off for this part, because I'm just going to inspect, this is cranial nerve number 7. I'm going to inspect your face. So can you show me your teeth? Okay, and smile. Okay, so I'm looking for facial droop, and there's no facial droop noted. You can put your mask back on. Now I'm going to test cranial nerve number 8. So this is for your hearing. So we're going to do the Rene and the Weber test. So you're going to hear a vibration. I'm going to put this on your mastoid bone right here. And then I want you to tell me when you can no longer hear it.
Mm-hmm.
And I'm going to put it in front of your ear, and you should still hear it. But again, I want you to tell me when you can no longer hear it.
Okay.
Okay?
I can no longer hear it. I can no longer hear it.
Okay. And we're going to do the same thing now for this ear.
Okay.
Okay.
I can no longer hear it. I can no longer hear it.
So air conduction should be twice as long as bone conduction, and it should be similar in both ears, which it is. So next we're going to do the Weber test. So for this one, again, you're going to hear a vibration, but I'm going to place it on your head, midline, and I want you to tell me if you hear it greater on the right, on the left, or if it's the same.
Okay. I would say I hear it the same.
Okay, very good. So next I'm going to test cranial nerve number 9 and 10. So I'm going to check for your gag reflex. And since I'm going to be looking in your mouth area, can you remove your mask please? I'm also going to assess for cranial nerve number 12, which is your tongue. So I'm just going to take a look inside your tongue. Okay? So for cranial nerve number 9 and 10, your gag reflex, can you open your mouth please? I'm going to check your gag reflex, okay? Okay? Gag reflex is intact. Then I'm going to check your tongue. So I'm going to move your tongue. Open your mouth please. I'm going to move your, stick your tongue out to the right and the left, and then up, and then down. And then can you say ah for me?
Ah.
Okay, and the soft palate and the uvula rise symmetrically. Next, I'm going to assess cranial nerve number 11, and that's, I'm going to test your strength in your neck and your shoulders. Okay, so for your neck, I want you to, I'm going to resist your movement, okay? So I want you to look to the right. Okay, very good. And then look to your left as I resist, okay? Very good. Okay, and then I'm going to test the strength in your shoulders. So I'm going to push down, and I want you to shrug. Okay, very good. So his neck and his shoulder strength is 5 out of 5. You can put your mask back on. Next, I'm going to assess his deep tendon reflexes. So we're going to start with the biceps. Can you flex your arm for me? Okay. Can you relax your arm? Just relax, okay? Okay, very good. And do the same thing over here, the biceps. Flex your arm for me. Okay, relax your arm. Okay, very good. Next, I'm going to test the triceps. So I'm going to have you just relax your arm, okay?
Mm-hmm.
Okay, very good. Then we're going to do the same thing over here for the triceps. Just relax your arm, okay?
Mm-hmm.
Okay, very good. Next, we're going to do the brachioradialis. Just relax your arm. Very good. And then again, just relax your arm. Okay, very good. And next, we're going to do your patellar reflexes. So, I'm going to take a look. Can you, dangle your leg like that. Okay, ready? Very good. Okay, very good. Next, I'm going to do your Achilles. So, again, dangle your foot. Very good. All right. So his deep tendon reflexes are about a 2+, and that's expected. Next, I'm going to test motor skills. So I'm going to ask you if you can keep your mask on. If you can close your eyes, and I want you to grab your finger and put it where your nose is. Okay, very good. It's intact. Now I'm going to ask for you to do the heel to shin. So I want you to run your foot. You can run your right foot down your shin, your left shin. Very good. And now I want you to do the same with your left foot. Run it down your right shin. Okay, very good. Next, we're going to do rapid alternating hand movements. So I just want you to put your hands on your knees like this, flip them, put your hands on your knees, flip them, a couple times. Okay. Very good. Okay. And next, we're going to do gait. So I just want you to walk forward a little bit to the dresser, and then turn around and walk back, and I'm just going to assess your gait. Okay. Okay, so gait is steady. Next I'm going to do the Romberg test. So I want you to stand here with your feet together. Okay. And then I'm going to ask you I'm going to have you close your eyes for 20 seconds and I'm just going to assess, okay? So you can go ahead and close your eyes. And I'm looking for swaying. Swaying would indicate a positive Romberg test. Okay, very good. You can sit down. So that was a negative Romberg. So next I'm going to assess your strength. We already assessed the strength in your neck and your shoulders when we tested for cranial nerve number 11. So we're going to do the strength in your elbows. So I'm going to ask you to curl your arms as I pull, okay? So curl your arms up. Okay, very good. And then with your arms curled, I want you to straighten them out as I push.
Okay.
Okay, very good. Next we're going to do your wrists. So I want you to extend your arms like this, and then I'm going to have you move your wrists up towards the ceiling as I push on your palms.
Okay.
Okay. Okay, very good. And then I'm going to have you push down, and I'm just going to feel the strength on your palms. Very good. Next, we're going to test the strength in your hands. So I'm going to stand in front of you. I'm going to stick my hands out, and then I'm going to pull back, but I want you to hold onto my finger still. Don't let go.
Okay.
Okay. Okay, very good. Next, we're going to test the strength in your hips. So I want you to raise your knee as I push down. Okay, so we'll start with your right. Okay, ready?
Mm-hmm.
Raise your knee. Very good. And then again, raise your knee. Very good. Okay, next we're going to test the strength in your knees. So for this exam, I want you to straighten your legs out as I push down on your shin. Okay, so we'll start with your right. Okay, ready? Very good. And then again, straighten your legs. I'm going to push on your shin. Okay? Very good. Okay. And then next we're going to do your ankles. So I want you to push down. We'll do your right foot first. Mm-hmm. I want you to push down like you're pushing on a gas pedal as I push up on the sole of your foot. Okay? Okay. Very good. And we'll do the same with the left. So push down like a gas pedal. And I'm pushing up. Okay. So his strength is all 5 out of 5. Next, we're going to test sensory tests. So we're going to start with graphesthesia. So for this exam, I'm going to have you close your eyes, and then I'm going to trace something on the palm of your hand. It's going to be either a letter or a number, okay? And I want you to identify the letter or the number, okay? So close your eyes, and then I'm just tracing something on your palm, okay?
T.
Very good. And then we're going to do the same over here.
Number 2.
Okay, very good. Next, I'm going to test the sensation, but we're going to do the sensation in your arms. And again, I'm going to test something that's dull, something that's soft, and something that's sharp. Okay? We're going to start with your arms, and I'm going to do your right upper arm, then your right lower arm, your left upper arm, and your left lower arm.
Okay.
Okay? So if you can close your eyes for me. Tell me what you feel. Okay, 1 second. Okay, tell me what you feel.
Something dull.
Okay, very good. Again, tell me what you feel.
Something dull.
Very good. Tell me what you feel.
Something dull.
Okay, and tell me what you feel.
Something dull.
Very good. Next, we're going to do a different object. And again, I'm going to put the object on your upper arm, lower arms, and I want you to tell me what you feel, okay?
Okay.
Tell me what you feel.
Something soft.
Okay. Tell me what you feel.
Something soft.
And then tell me what you feel.
Something soft.
And again, tell me what you feel.
Something soft.
Okay. We're going to test one more object, okay?
Okay.
In your right upper arm, tell me what you feel.
Something sharp.
Okay. Tell me what you feel.
Something sharp.
Okay. Tell me what you feel.
Something sharp.
And tell me what you feel.
Something sharp.
Okay. So his sensation is intact. You can open your eyes. So we're gonna do the same thing, but this time I'm gonna do it in your legs. Okay? So I'm gonna ask you that you close your eyes, and then I'm gonna rub something, 3 objects on the upper part of your legs and then the lower part of your legs.
Okay.
Okay, and I want you to tell me if it's dull, soft, or sharp.
Okay.
So go ahead and close your eyes. So, right upper leg, what do you feel?
Something dull.
Okay. Lower leg, right lower leg, what do you feel?
Something dull.
Okay. Left upper leg, tell me what you feel.
Something dull.
And then left lower leg.
Something dull.
Okay, very good. I'm gonna test a different object. And I want you to tell me again, is it dull, soft, or sharp? Okay? And the right upper leg.
Something soft.
Okay, right lower leg, what do you feel?
Something soft.
And then left upper leg, what do you feel?
Something soft.
And left lower leg, what do you feel?
Something soft.
Very good. One last object, okay?
Okay.
So, right upper leg, what do you feel?
Something sharp.
Right lower leg.
Something sharp.
Okay. Left upper leg
Something sharp.
and left lower leg.
Something sharp.
Very good. You can open your eyes now. So next, I'm going to test the sensation in your feet. So for this exam, I'm going to ask if you could please lay on the bed.
Okay.
And then I'm going to use a monofilament to test the sensation in your leg. So I'm going to prick something like on your great toe, and then underneath your great toe, underneath your pinky, and then on the heel of your foot. And I want you to tell me when you feel it.
Okay.
Okay? So, ready?
Uh-huh. I feel it.
Okay.
I feel it. I feel it. I feel it.
Very good. I'm going to do the same to your left foot. Okay.
I feel it. I feel it. I feel it. I feel it.
Okay, so his sensation in his feet bilaterally is intact. Next, I'm going to test, it's called position sense. So I'm going to have you stay laying down. And then I'm going to have you close your eyes. And then basically I'm going to move your finger either up or down. And I want you to tell me if I'm moving it up or down. Okay?
Okay.
So close your eyes.
Up.
Okay, very good.
Down.
Okay, so that was on the right hand. I'm going to do your left hand now. And again, close your eyes and tell me if you feel it up or down.
Up.
Okay.
Down.
Very good. So the left hand. Now I'm going to do the same for your feet. Okay?
Up. Down.
Okay, very good. Now I'm going to do the same on your left foot.
Down. Up.
Okay, very good. Now, if you could please come and sit on the chair. And we're going to test, this is called stereognosis. And basically, I'm going to have you close your eyes, and then I'm going to put 3 different objects in your right hand, one at a time. And I want you to tell me what object it is. Okay? So we'll start with your right hand. And close your eyes. Keep your eyes closed and tell me, you can go ahead and feel it. What is it?
Paper clip.
Okay, very good. Keep your eyes closed and then tell me what this is.
A coin.
Very good. And then keep your eyes closed and tell me what this is.
A safety pin.
Very good. Okay. So we're going to do the same. You can open your eyes. We're going to do the same thing, but for your left hand.
Okay.
Okay, I'm gonna put 3 objects in your hand and I want you to tell me what they are.
Okay.
Okay, so keep your eyes closed.
Coin.
Okay, very good.
Paper clip.
Okay.
And a safety pin.
Very good. Okay, you can open your eyes now. And this concludes the neurological examination.